A COVID-19 vaccine mix-up. A local parent says her 7-year-old was mistakenly giving the adult dose of the COVID-19 vaccine.
And Jennifer, since then, she said her child has a sore red arm with a slight fever. Let's get straight out to Paula Soro. She joins us live with more from this very concerned mom. Paula?
Yeah, guys, it's in this Walgreens off of Camp Creek Parkway where the mother, who does not want to be identified, tells us her 7-year-old was vaccinated. In fact, they say several kids were here getting their COVID-19 vaccine on Sunday, but it wasn't until yesterday, Wednesday, when they say the pharmacy finally called to let them know.
So it took them 3 days to realize that something had gone astray. There wasn't very much concern, I guess. She didn't ask if the child had any side effects or anything. She just said there was a mix-up.
That mix-up has led to some uncomfortable days for her 7-year-old.
She's been complaining since Sunday that her arm is very sore. She has a very hard red knot on her arm.
As a former pediatric nurse, she knew to call her daughter's pediatrician, who spoke to the CDC.
They said that was just something to continue to eyeball, and if by Monday it's still persistent, I have to take her in and have her checked out.
Now, Walgreens sent us a statement saying in part that events like this one are rare. They say that they actually have a, quote, multi-step vaccination procedure, which includes safety checks to minimize the chance of human error. Jennifer?
Paula, do you know if the state is seeing this happen, and what is every parent to do if something like this that's happening is dangerous? What are they supposed to do?
Yeah, Jennifer, I actually spoke to the Georgia Department of Public Health tonight, and they tell me that this is not only happening in Georgia, but nationwide. And they say that although this is preventable and should not be happening, parents should not panic. Dr. Alexander Millman, DPH's chief medical officer, says clinical trials for Pfizer's pediatric vaccine tested different dosages.
Even though children who received a higher dosage of the Pfizer vaccination may have had more frequency of certain side effects like headache. Some of them had fevers. The good news is there were no severe adverse events. There were no deaths among those who had received higher doses.
The pediatric dose inside of the vial with the orange cap is 10 micrograms compared to the 30 micrograms inside the purple vial, which is an adult dose. If a child gets 30 micrograms, Dr. Millman says the possible side effects resolve after 24 to 48 hours.
The things that would be more alarming are things where somebody has an incredibly high fever so that they're not able to, they're really not able to function as they normally would. Somebody who is unable to eat or drink. Anybody who's having any type of respiratory difficulties.
If your child's first COVID-19 vaccine comes as an adult dose, Millman says they should still get a second dose after the standard 21-day waiting period. This time, however, the pediatric dose. Now, Dr. Millman recommends that you bring your vaccine card with you whenever you're getting your vaccine. That way, that person administering the vaccine is able to triple check they're giving you the right one. Also, check the vial cap color. Again, purple for adult dose, orange for that pediatric dose. Also, if your child was in fact given the wrong dose, that provider is supposed to reach out to you and to the CDC.
All right, Paula, keep an eye out for those orange caps for children. Thank you so much.